today I will talking about the action potential. Action potential mainly the clinical clinical significance. Clinical significance like which nerve fiber has the greater velocity of conduction, which has the lower, and how is the conduction of the in unmyelinated and myelinated fiber, and how action potential action potential will be reduced or will be reduced or the what how will be the mechanism action of the local anesthetics that mainly act by blocking the sodium channel, and hence reduce the generation of action potential and its transmission. And then at the end of the lecture I will be talking some important MCQ question in this action potential, resting movement potential and action potential, and one important uh, exporter of the physiology from this action potential. All I will be dealing here, and this will be the uh, part 3 of action potential, and hope you have been through part 1 and part 2 of the action potential. So let's start. Action potential. Action potential we have talked about detail in part 1 and part 2 of lecture. Now let's see its conduction of action potential in myelinated and on myelinated nerve fiber. Myelination generally increases the rate of transmission of the nerve impulse. How? I will be showing here. Let's suppose this is a multipolar neuron. Here will be dendrites, let's suppose this is cell body, there will be nucleus, this is cell body, this is axon terminals, and this is axon. Myelin sheath is actually the insulating substance that is produced by Schwann cells and insulation for the sodium ions and other ions. That is, this myelination being insulator will reduce the entry of sodium ions mainly, sodium ions mainly through it. Somewhere here will be swan cell, and this all will be your myelin sheath, myelin sheath, and this swan cell will produce sphingomyelin, sphingomyelin. It is a type of lipid that will be present in the myelin sheath. This will be insulating this axon part, and here will be no transmission of the no influx or efflux of the sodium ions mainly, and or other ions. So this myelination produce a typical type of and this is your nodes of Ranvier. Nodes of Ranvier. Through these nodes of Ranvier, only the sodium ions will get influxed. So when the action potential will generate at axon hillock or other location, the transmission, let's suppose here sodium gets influxed, sodium ions are positive charge if threshold stimulus is applied. Sodium, then how will be the transmission? By skipping some space, not the throughout the space, entry of the sodium ions will take place. Here at this the sodium influx through these nodes of Ranvier only, and if you want to know, not necessary, this one, the space between two nodes of Ranvier, the space or length will be how much? 1 to 3 millimeter, and these nodes of Ranvier space width will be 2 to 3 micrometer. So how is the transmission here? From here, in this manner, the transmission of impulse will take place by jumping certain spaces in the myelinated nerve fiber. But in non-myelinated nerve fiber, the sodium ion should or will influx throughout the nerve fiber, that is without skipping the any space. So this type of transmission is called as the saltatory conduction. Saltatory conduction, this will take place in the myelinated nerve fiber. Myelinated nerve fiber. So now let's suppose this length and this length is of axon is equal. So in which nerve fiber the impulse transmission will be, rate of the impulse conduction will be faster? Obviously in this myelinated nerve fiber, because in this nerve fiber at the, when this sodium gets influxed here, this will depolarize up to this space, up to this space, only from influx of the sodium by this space, and again here will be the influx. When depolarization comes here, influx will be here, and when depolarization up to will be here, then again influx will be at this point only, So in that case the transmission of the nerve impulse will be faster. For simplicity, let's take an example. Let's suppose you have to invite 100 home. You have to send invitation 100 homes, 100 homes, 100 homes, and other condition, let's suppose, is constant, like if you going in a straight path by on foot or by any vehicle, your speed should be same for the both cases. And let's assume in one cases, if you invite one home, it will cover 10 home. Then how many times you should enter in homes? For 100 homes, 10 times. That is, in 10 times you will cover the 100 home. And in general condition, let's suppose you have to go in every home, and you spend in every home the same time. Then in that condition, what which work will be finished earlier or faster? This, when you will cover one home and it will be assumed to be covered that 10 homes. So in the same manner, the action potential, rate of the action potential transmission will be faster in the myelinated nerve fiber. Now talk about the diameter of the nerve fiber. Diameter of the nerve fiber. Diameter of nerve or muscle fiber. How will it affect? In this case, let's suppose a nerve fiber is diameter of this much, and next nerve fiber of diameter is this much, and you know the physics far better that resistance will be equal to L by R to the power 4. This implies R will be directly proportional to L and inversely proportional to the radius of the radius, and you know 2r equals to diameter. Here again 2r equals to diameter, inversely proportional to the r to the power 4, and also you know here R is the resistance. R will stand for resistance. From Ohm's law you also know that B equals to IR. The transmission of the nerve impulse or muscle fiber impulse will be same as like the flow of the electric current. So this implies I will be inversely proportional to the resistance. That is, if the resistance is higher, the flow of electric current will be lesser and vice versa. So by applying all these laws, the transmission will be higher in the speed of conduction will be higher in large diameter nerve fiber. So, and also this is the theoretical thing, and you can apply common sense also, that higher the diameter, the surface area of this axon is like cylinder. The higher the diameter, its surface area will be higher, and higher the surface area, there will be higher number of the channels, sodium channels, potassium channels, there will be in higher number if the length is constant. And higher the number of the channel, higher will be the influx of sodium and influx of the potassium, and that will lead to the increased rate of conduction. This is about the diameter of the nerve fiber. And here is also the length. Length is not so much. Yes, obviously length. Here R is directly proportional to the length. So higher the length, the rate of impulse transmission will be lesser, assuming other conditions as constant. So this will be the length factor, and by this all, we can conclude that in myelinated nerve fiber, the rate of impulse transmission will be higher than unmyelinated nerve fiber. In larger diameter nerve fiber, the rate of impulse transmission will be higher than a smaller diameter nerve fiber, and length, the shorter the length, the rate of impulse transmission will be higher, because in larger length, longer length, the resistance will be higher. That is assuming the electric current, flow of the electric current, this will affect, length will affect the rate of transmission of the impulse, but this length is not great factor, in case of nerve impulse transmission. Rather, these two, diameter and myelination, will affect much the rate of the transmission of the impulse. So, this is about the rate of the conduction in different nerve fibers. And also you should know one more thing, that the rate of impulse transmission is from 0.5 meter per second to 120 meter per second. So, this a smaller or slower rate will be in unmyelinated nerve fiber and or a smaller diameter nerve fiber, and this higher rate of transmission will be in large diameter nerve fiber and or myelinated nerve fiber. And generally also it is assumed that in myelinated nerve fiber the impulse transmission rate will be greater than 15 meter per second, So, this is the rate of impulse transmission. Remember, this 120 meter, it is the larger than a football ground. That much distance is covered within 1 second. And in case of this smaller diameter and unmyelinated nerve fiber, the impulse from the great toe, sensory impulse, when come to the spinal cord, lower part of the spinal cord, it will take 2 seconds, nearly 2 seconds. So, this is the rate of impulse transmission. And also remember here, I will talk in detail about this in nervous system. Also remember, for slower transmission will occur in generally C type fiber, and higher or faster transmission occurs in A delta fiber, A delta, A alpha, A beta. There are many other fibers also. For example, remember, slower conduction in C type fiber and faster conduction in A delta fiber. You might be asked in Viva, give the example of the faster rate of transmission, give the example of fiber that transmits impulse in faster rate, and give the example of the nerve fiber that transmits action potential or nerve impulse in slower rate. So, remember these two examples. Now let's discuss few MCQs that are frequently asked in exams. And this if you read in detail this action potential, and you will see my videos in detail, this this MCQs will not be difficult to solve for you. So the question is here very simple: saltatory conduction of nerve impulse takes place through option A, myelinated nerve fiber, myelinated nerve fiber. B will be unmyelinated nerve fiber. C will be both A and B, D none. So this is very simple MCQs. So I should not explain detail. Obviously this type of transmission will be in myelinated nerve fiber. And why I am showing you the MCQs, because in KU there is provision of the 30 marks MCQs out of 80 marks in the theory exam, and a student are generally scared of the MCQs, that what type of MCQs will be asked, how I will solve the MCQs. So if you know the theory well, if you know the theory in detail, the MCQs will not be the big deal for you, and this MCQs point will also be important for the viva question. So the MCQ is nothing from outside but the theory, that you are taught. Next question will be the disrupted sodium potassium concentration outside and inside of nerve fiber or muscle fiber, nerve fiber re-established to its to their normal inside and outside concentration, normal inside and normal outside and inside concentration by your options are potassium channels, sodium channels, C will be sodium potassium pump, D is, let us suppose, non. So remember, read the question carefully. The disrupted sodium potassium concentration outside and inside of no fiber is re-established to their normal outside and inside concentration by which pump? I have talked in detail in part 1 action potential video in resting moment potential that it is the feature of the sodium potassium pump. Sodium potassium pump also contributes at some extent in establishing the resting moment potential, but it has far more contribution to re-establish the disrupted sodium potassium ion concentration outside and inside no fiber. For example, during the action potential, there what will happen? The sodium ions will get influxed, and during the depolarization and during the repolarization, the potassium ions will be effluxed. Through voltage gated potassium channel, and here initially by mechanically gated, and after threshold potential there will be opening of the voltage gated sodium channel, and the influx will occur through the voltage gated sodium channel. So during depolarization, here will be the positive charge, and to neutralize this positive charge inside, the potassium ions will be effluxed. Then here the concentration will be, sodium concentration will increase inside the nerve fiber, and potassium ion concentration will increase outside the nerve fiber, that is opposite to the normal condition. So once the action potential is transmitted, again it should be again the sodium potassium concentration will be maintained at normal condition, that is this sodium should be effluxed and this potassium should be influxed to maintain the normal concentration, that is higher concentration sodium outside the nerve fiber and lower higher concentration of the potassium inside the nerve fiber, and this will be done by the sodium potassium pump. This pump what will do? It will transport 3 sodium outside and transport 2 potassium inside by the action of sodium potassium by active transport. This is the active transport, primary active transport sodium potassium ATPase, that is direct ATP will be utilized here. utilized here, ADP plus inorganic phosphate, inorganic phosphate, and this will re-establish the normal concentration of the sodium and potassium. So, the answer will be sodium potassium pump. Next question, is very simple. Sorry. Which ion produces action potential in a nerve fiber, sodium, potassium, calcium. This will be chloride. So here the answer is sodium, you know very well. In nerve fiber, but remember, I will talk later that in cardiac muscle the action potential is generated by the influx of this calcium ion. That is initial influx up to the threshold potential will be the will caused by the sodium ion, influx of the sodium ion, and then after threshold potential the calcium ion will cause the depolarization there. So if there is cardiac muscle, please go for the calcium ion. Next question is, let's talk about the mechanism of action of the LA. Mechanism of action of the LA, that is LA, local anesthesia, local anesthetics. For example, procaine, lidocaine, bupivacaine, ropivacaine. There are many examples. Local anesthetics act by blocking. Option is sodium leak channels, B, mechanically gated sodium channels, C will be voltage gated sodium channels, D is voltage gated potassium channels. Before moving to this answer, let's talk brief about the mechanism action of the local anesthetics. This is the voltage gated sodium channel. Sodium channel at resting condition, this will be activation gate, and this is inactivation gate. And at normal resting condition, activation gate will be closed and inactivation gate will be opened. This is inside, let us suppose ICF, and this is ECF, extracellular fluid. So somewhere here will be binding site of the local anesthetic, LA receptor, and LA receptor, the local anesthetic agent will influxed through this membrane, and here is the undissociated form. Let us suppose here it will get dissociated, and now it will bind here. So this binding of the local anesthetic here in voltage gated sodium channel will inhibit the opening of voltage gated sodium channel, and reduce the rate of impulse generation and transmission. Though there is a stimulus, even threshold stimulus, the action potential will not be generated due to this LA agent. It bind the LA receptor somewhere here and block the or inhibit the opening of this activation gate. So no activation, no influx of the sodium through the voltage gated sodium channel, and there will not be the generation of the action potential and hence transmission. And the degree of this action will depend upon the concentration and efficacy of the local anesthetics. That is, higher the efficacy and higher the concentration, it will more effectively block this channel. So you know, then answer will be voltage gated sodium channel. Why? It is blocking the voltage gated sodium channels. And detailed mechanism action and detail about this channel will be dealt in the mechanism action of the local anesthesia in pharmacology. Next question is, an action potential in the nerve fiber is produced when positive and negative charges when positive and negative charges on the outside and the inside of the axon membrane are reversed because more potassium ions enter the axon as compared to sodium ions leaving it. B is more sodium ions enter the axon as compared to potassium ions leaving it, or when all potassium ions leave the axon. D is all sodium ions enter the axon. Again, I have talked about this in detail in part 2 action potential video, that by positive feedback mechanism the sodium action potential is generated. How? When the threshold stimulus or stimulus is applied, the sodium ions will get influxed, and to balance or neutralize these positive charge inside the membrane by this influx of the sodium channel, there will occur efflux of the potassium ion beginning before the threshold potential. At beginning this will occur. So once, let's suppose 2 sodium ions get influxed, 2 potassium ion will get effluxed and neutralize the this positive charge inside. But action potential is generated only once when the rate of this sodium ions influx will be higher than the efflux of the potassium ions. Potassium ions, or if the stimulus is greater or equal to 15 millivolt, 15 millivolt, 15 millivolt, 15 plus 15 millivolt, then only the action potential will be generated. So same thing here. The correct option will be more sodium ions would enter as compared to potassium ion leaving it. Only at that condition action potential will generate. Action potential is generated. There are many other questions also, so I don't want to consume your much time. So any MCQs of this action potential you can deal or you can solve if you have gone through the detailed videos of action potential. And I will talk one more MCQ here. This which is the typical MCQ. The question is safety factor. Question is safety factor for propagation of action potential is. What is the safety factor? There is something called safety factor. So option is ratio of action potential strength, and excitability, excitability. This action potential strength and excitability, the ratio is called should be excitability should be always greater than 1, greater than 1. This is called the safety factor for the action potential. That is the action potential strength as long as action potential strength as long as greater than the threshold stimulus or excitability potential, excitability stimulus causing, till then the action potential will transmit only. This is called the safety factor. Now talk about the exporter. This figure of action potential you will be provided 0.1, 0.2. This is the time in millisecond, and this will be potential in millivolt. Potential in millivolt. Let's suppose something here is resting potential of minus 70 millivolt. Here is the 0 millivolt or 0 potential. Here is the plus 35 or 30. Let's suppose plus 30 millivolt. volt, 30 millivolt. So this graph will be given, and here will be something, some marking, let's suppose this mark is A and this whole throughout mark is B, this is C, this is your E, and this is your D. So question will be this time or this potential voltage, potential will not be given also, simply this figure will be there. So your question will be, what is the phenomena? What is the phenomena occurring there, or phenomena occurring there? Your answer should be action potential. Or this figure shows, what is the figure of this, what this figure means or implies. Next question here will be, enumerate or name the marked points or area. What this signifies? So A will be threshold potential or firing potential. B is depolarization. C is spike potential. C is spike potential or overshoot. E is repolarization. And D is hyperpolarization. D is hyperpolarization. Might be asked a spotter like this in 5 marks, or in same figure, you will ask that process B is caused by influx of the sodium through voltage gated sodium channel, that is depolarization. Again, E is caused by efflux of the potassium ions through voltage gated potassium channels, and this depolarization, hyperpolarization or undershoot is caused by delayed opening of the potassium channel. Delayed opening of the potassium channel will lead to the even greater efflux of the potassium ions than at normal conditions. So in this way you will be asked the spotter. So this is all about the action potential. There are many other questions also. Please go and solve the questions, and if you found anything difficult or any confusing thing, any questions, please comment on the comment box, and I will try to clear those curiosity as much as I can. So thank you for watching the video.